Hi everyone. So let's start with the biochemistry section. So question number 1, which of the following vitamin is teratogenic in large doses? So guys, teratogenic vitamin is only one, and that is vitamin A, right? So no confusion in that. Direct question. Okay, so we must remember the teratogenic vitamin which are not safe in the pregnancy, and that is vitamin A, should not be given after 1 month of conception. Okay, that can be toxic to the developing embryo and can cause various complications, especially the neurological. The most of the complications are CNS complications. Okay, so what are the CNS complications it can cause? It can cause, like, for example, spina bifida. Okay, one of the complications that it can cause. Then there are various other complications like absence of thymus gland, right? It can also cause that. Fine, so vitamin A is our answer. See guys, most of the fat soluble vitamins are toxic. Water soluble vitamins are non-toxic except vitamin niacin and B6. So B6 and niacin, these are the only two toxic vitamins, while in the fat soluble vitamin, most of the vitamins are toxic. Fatty acids used as a therapy in the management of hypertriglyceridemia. So guys, which fatty acid decreases the TG levels? The only one fatty acid which decreases TG level, that is omega-3. Okay, so just remember, like 3, omega-3 and TG. It has no effect on cholesterol or minor effect on cholesterol. So we must remember that omega-3 causes the decline or decrease in the TG, and that's why it is used in the management of hypertriglyceridemia. Okay, so remember this. Okay, omega-6 has effect on the this cholesterol. It decreases the LDL and total cholesterol also. Olive oil is monounsaturated fatty acid. Guys, this is the only, I would say, just to remember this, MUFA. So MUFA is found in both the mustard and olive oil, and MUFA has a very nice effect, that is, it can increase the HDL. So this is the only type of fat that is called as MUFA, which can increase the HDL levels, good cholesterol levels. And the only fatty acid which decreases the TG level, that is omega-3. So these are unique in these terms, right? All of the following are true regarding the structure. So structure is of cholesterol, and guys, cholesterol is a structural component of membranes. Yes. Nerve conduction, so that is part of the myelin sheath. Kidney plays a role. No. So that is the answer, except they have asked. It is one of the component of plasma lipoproteins for sure. Which lipoprotein has a maximum cholesterol? That is LDL. LDL has the maximum cholesterol levels. Clear? If the content of adenine is 15%, what is the amount of the G in the DNA according to the Chargaff's rule? So guys, DNA is a double-stranded molecule. So A is given as 15%. So T is also 15% now. A binds with the T, and then G bind with the C. So 15, 15, 30. So remaining is 35 and 35, 70. Right? So the answer will be 35%. Got it? So I have to make it 100%. So 15, 15, 35, 35. So that's the answer. Very simple. Guys, remember, RNA don't follow the Chargaff's rule because most of the time RNA is single-stranded. Right? So RNA, if A is 15, that it's not necessary T will also be 15. So RNA is a single-stranded molecule in general. Though some viruses may have the double-stranded RNA, but that is a case which will be mentioned in the MCQ. So if they mention this, that there is a double-stranded RNA, then you can apply this rule. But there will be uracil, not the thymine. A binds with U in the RNA, not the T. Which of the following prosthetic group or the coenzyme, so will be involved in the reaction highlighted. So this is the highlighted reaction, succinyl-CoA plus glycine. So guys, this is making ALA. So the name of enzyme is ALA synthase. That is a rate limiting enzyme of heme synthesis. कौन सा? Heme synthesis. तो इसमें होता है B6. Vitamin B6 is the correct answer. Okay. So guys, vitamin B6 is required for heme synthesis, and that is why vitamin B6 deficiency can lead to microcytic anemia. Got it? Microcytic anemia. जो iron deficiency type of anemia होता है वैसा. Long chain fatty acid is transported into the inner mitochondrial membrane by. So the answer for this question is acyl carnitine. Guys, acyl carnitine is something which is required for the transport of fatty acids to the mitochondria. Okay, transport of fatty acids through the mitochondria. And guys, carnitine is a dipeptide, right? It is dipeptide made of lysine plus the methionine. Okay, lysine plus methionine. Okay, so that is called as carnitine. Match the physical finding with the corresponding lipid profile. Options are being hidden because of some problem here, right? So don't worry. So the question is showing us the orange tonsils, right? As you can see, these are orange tonsils. So guys, orange tonsils occurs in which disease? What's the name of the disease? Tanger's disease. Okay, so name of the disease is definitely, we know, the Tanger's disease. And in the Tanger's disease, the HDL levels are low, that is less than 10. So the answer will be HDL low, right? This will be the answer, not, it's hidden here, but you know the options already. Okay guys, so that is your Tanger's disease. Also, in this case guys, this is a LCAT deficiency and the fish eye disease. As you can see, right, there is a, what I can say, the periphery is being, blurred, right? What I can say, clouded. So that is fish eye disease, and that is because of LCAT enzyme deficiency. Again, the HDL will be low. Clear? So guys, this is a question in which the point that we can understand here is that distinct acetone odor from her breath. Okay. So the patient was admitted in the emergency and has an acetone odor from the breath. So that is a case of diabetic ketoacidosis probably. So what they are asking is, already the sugar is high, so it's a case of diabetes for sure. Which of the following test is employed to detect the ketone bodies in the urine? So guys, for the urine, we have Rothera's test, right? Rothera's test identifies acetone and acetoacetate, but not the beta hydroxybutyrate. Okay, so this is not for beta hydroxybutyrate. So beta hydroxybutyrate is not identified by Rothera's. So for that, you have to check for the blood BHB. So if they ask you that what is the best test, it's not Rothera's. In a case of diabetic ketoacidosis, what is the best test? So I will answer any test jahan pe option hoga. So I will answer blood BHB levels. Okay, blood BHB levels. Fine. So that will be the answer. Okay, HMP shunt is the only source of. So guys, the word only is important here. So don't mark NADPH, because for NADPH I have three sources. One is HMP shunt, then second is the malic enzyme. Okay, malic enzyme, and third is cytosolic isocitrate dehydrogenase. That is cytoplasmic, not in the mitochondria of Krebs cycle. So isocitrate dehydrogenase, वो cytoplasm वाला, वो जो not part of Krebs cycle है. Malic enzyme, right? So ये HMP तो है ही है, तो तीन source हो गए हमारे पास. So guys, answer is ribose 5-phosphate, because we don't have any source of pantose sugars apart from this HMP shunt. So that's why this question is not that direct. It is tricky, and don't jump to the answer कि भाई NADPH है, right? Okay. Which of the following amino acid is non-toxic transport form of ammonia from brain to the liver? So guys, the question is repeated, non-toxic transport form of ammonia, very common question, and the answer is glutamine, right? Just remember, glutamine is carrier of ammonia in the blood. Carrier of ammonia in the blood कौन सा है? Glutamine. Okay, fine, right guys? ऐसे याद रखो कि the ammonia has been glued, right, in the glutamine. So glutamine is the bound form of ammonia, right? Free form तो toxic होता है ना, that is a bound form of ammonia. 65-year-old man complains of the chest pain, and so it's a case of like heart attack, right? Myocardial infarction. Which of the following isoenzymes? So guys, answer isoenzyme specific to the heart or myocardium is CKMB. Guys, normally CKMB levels are very low. They are just 3 to 5% of CK total. तो एक हमारे पास वर्ड होता है CK total. टोटल में ये दोनों आता है, ऑप्शन ए और बी, इनको बोलते हैं हम टोटल. तो CK टोटल जो होता है उसमें सिर्फ 3% ऑफ CKMB होता है, तो दैट इज नॉर्मल. ओके, तो जब हम टेस्ट करते हैं तो हमें टोटल वैल्यू लेनी होती है. तो अगर टोटल का CKMB का जो वैल्यू है वो 3% ही है ना, मान लो 100 था टोटल और ये 3 आया, तो MI नहीं है. बट अगर मान लो ये 100 था और अगर मैं इसको बोल दूं 15 to 30%, करीब करीब, राइट। तो एवरेज चलता है मान लो 25%, ऐसे याद रखो 25%। तो अगर इसकी वैल्यू 25 आ गई है ना सी के एम बी की, तो एम आई है। ये एग्जाम्पल दे रहा हूँ सिर्फ आपको ना, वैल्यू विल बी डिफरेंट ऑब्वियसली इन द लैब। 100% का 25% बस, तो 25% के करीब आ रहा है, तो दैट इज अ केस ऑफ मायोकार्डियल इन्फार्क्शन। ओके, A 3-day-old infant was brought to the emergency room by the mother. So guys, ये भी ये क्वेश्चन है जो बहुत सिंपल है, because there is a smell, right, which is detected to be the burnt sugar odor from the baby's diaper, right? So it's a case of maple syrup urine disease, है ना। बस क्लिक होना चाहिए क्वेश्चन शुड, आंसर शुड बी क्लिक्ड कि यार ये ऑर्डर तो ये आंसर है ना। हमें फालतू चीजें पढ़नी ही नहीं है, हमें डिस्ट्रैक्ट होना ही नहीं है, बस बर्न शुगर ऑर्डर मतलब ओनली चांसेस मेपल सिरप यूरिन डिजीज। व्हाट इज द नेम ऑफ एंजाइम इन द मेपल सिरप यूरिन डिजीज? अल्फा ब्रांच चेन अमाइनो एसिड अल्फा केजी डिहाइड्रोजनेज, अल्फा कीटो डिहाइड्रोजनेज, राइट। ओके, सो ब्रांच चेन अमाइनो एसिड अल्फा कीटो डिहाइड्रोजनेज एंजाइम, एंड दिस एंजाइम इज डिपेंडेंट ऑन थायामिन। गाइज आई टोल्ड यू दैट पीडीएच जैसा ही एंजाइम होता है ये, पीडीएच भी थायामिन पे डिपेंडेंट होता है ना, पायरुवेट डिहाइड्रोजनेज, सेम इज लाइक दिस। सो बीसीडब्ल्यू अल्फा केजी डिहाइड्रोजनेज, सो आंसर इज विटामिन B1। ओके, सो क्वेश्चन इज इन दिस क्लिनिकल सिनेरियो व्हिच ऑफ द फॉलोइंग इज रिक्वायर्ड कोफैक्टर ऑफ द डेफिशिएंट एंजाइम। तो इनडायरेक्ट क्वेश्चन है, क्लिनिकल बना के, थायामिन इज अ सिंपल आंसर। ठीक है, तो गाइस एंजाइम देखो, विटामिन का हमें क्लिनिकल पता होना चाहिए, बट वी शुड ऑल्सो नो दैट इस विटामिन का एक्चुअल कोफैक्टर रोल क्या है, वो भी पता होना चाहिए मुझे, राइट। आइडेंटिफाई द ट्रांसपोर्टर है, तो गाइस ये फ्रक्टोज को अंदर लेके जा रहा है इन द इंटेस्टाइनल सेल। ये एंटेरोसाइट है, ये ब्लड है ना, ये ल्यूमन है। तो गाइस ये तो GLUT5 हो गया फॉर श्योर। और देखो अगर वो पूछता आपसे कि भाई ये सी कौन सा हो सकता है, तो ये हो सकता है GLUT2, क्योंकि सारी शुगर GLUT2 के थ्रू ब्लड में जाती है ना। ये आपसे कोई पूछे बी क्या हो सकता है, तो गाइस बी बोल सकते हैं SGLT हो सकता है ये। ओके, सो दैट्स ऑल। सो फ्रक्टोज ट्रांसपोर्टर कौन सा है? नंबर 5, दैट इज GLUT5। विच ऑफ द फॉलोइंग इज अ फंक्शनल प्लाज्मा एंजाइम। तो गाइस देखो, जो एंजाइम्स होते हैं वो ब्लड में, एंजाइम्स व्हिच आर प्रेजेंट इन द ब्लड, दे हैव अ सबस्ट्रेट इन द ब्लड। यू गेटिंग अ पॉइंट? Functional plasma enzyme means, the substrate is found in the blood. Okay, so that is called as a functional plasma enzyme. So, out of all the options, guys, the only enzyme which has a substrate in the blood is prothrombin. Guys, prothrombin is just not a protein. कि आप सोचो कि यार ये तो कोएगुलेशन फैक्टर है, तो इट्स ए प्रोटीन, इट्स एंजाइम, राइट। सीरीन प्रोटीज ग्रुप का एंजाइम है ये, है ना। तो जो ब्लड कोएगुलेशन फैक्टर्स होते हैं, दे बिलोंग टू ए ग्रुप ऑफ एंजाइम दैट इज कॉल्ड एज सीरीन प्रोटीएज। ओके, सीरीन प्रोटीएज इज द नेम। यू गॉट माय पॉइंट? सो दैट इज कॉल्ड एज प्रोथ्रोम्बिन। तो गाइस ब्लड कोएगुलेशन फैक्टर्स, देन व्हाट एल्स? Others are, guys, बाकी सारे हैं जो ये, these are non-functional plasma enzymes. So these are used in some diagnostics. जैसे CK is used in muscle disease, जैसे अभी हमने पिछले क्वेश्चन में देखा CKMB, heart disease. Lipase is for like pancreatitis. तो ये pancreas में होता है, not in the blood. ये है functional in the blood. That is functional plasma enzyme. What are the examples? जैसे कि एक और example हमें याद रखना है. What is that example? That example is very important name, that is called as lipoprotein lipase. Okay, that is very important name. Okay, not the hormone sensitive lipase, lipoprotein lipase. Okay, so that's the name that we should know. During prolonged starvation, the brain depends on, simple, that is answer is ketone bodies. So option number C. Okay, prolonged starvation, guys, especially remember that after 72 hours, okay, the brain is able to, so when equal to 72 hours ho jayenge, 3 days, so the brain is able to use the ketone bodies. Okay, fine. 15-year-old male presented with the complaints of pain during urination and decreased urination. He also complained of pain in the lumbar region. X-ray, KUB, renal stones are seen. Okay, amino acid expected to excreted in the urine, right? So guys, this is the image shown, which is a hexagon, right? As we can see, hexagonal crystals are found in cystine urea. They are made up of cystine. Again, I'm repeating, cysteine is different. Cysteine is a amino acid. Cysteine is the two cysteine together. When I take two cysteine and, bound them with the sulfur, that is two sulfur actually, disulfide bond. So that is called as cysteine. Okay. So cysteine urea it is, not cysteine urea. So cysteine will be there, ornithine will be there, arginine will be there, all of the above actually. So which of the following amino acid expected to be excreted? Okay, my answer will be changed now. All of the above, because COLA appears in the urine: cysteine, ornithine, lysine and arginine. Right? Cysteine, ornithine, lysine and arginine. So these are the 4 amino acids which will appear in the urine. You got my point? Okay, fine. So guys, that's it. These are the questions. So I wish you all the best again. Keep revising. Do your best. Make it your last chance to, pass the exams. Right? Be motivated and disciplined, most importantly. Make a discipline. Keep your, study hours of minimum of 10 to 12 hours per day. Right? Without any distraction. It's like last few days remaining. Bye bye guys. All the best.